Well, joining us now from New York is Willibald Zek. Willibald is UNICEF's global maternal, is the head of UNICEF's global maternal and newborn program, and in fact was one of the contributors to this report. Zek, welcome to the program. Zek, when UNICEF says the world is failing babies, what does it mean specifically for the African continent?
I would not say failing, but I would say that there are concerns on some issues that governments are very well aware. And I think it's common sense and everyone knows that the African continent is particularly impacted by high mortality rates among newborns. And it's just confirming what we knew. I think it has to do really also with the fact that we have many governments or countries on the African continent that face fragility, fragile states, natural disasters, but also conflict. And we also know that conflict directly correlates with mortality. The reason being that pregnant women or people in general have no access to health services and have just a lower chance to receive health services. And during pregnancy, such services are crucial, of course. But on the other side, we have, Africa is a huge continent and it has a variety of countries, cultures, and ethnic groups. And so I think we cannot generalize the sub-Saharan or the continent in general, but what we can see also that there are a number of countries that are stepping up towards middle-income status, and there we see some improvement that is really promising for the next 10 or 20 years.
Zek, you say that the report cannot generalize for the entire continent, but in the same report, 8 of the 10 worst countries to be born in are in sub-Saharan Africa. For example, in the Central African Republic, which was mentioned, it says 1 in 24 newborns dies. What steps can be taken to save 16 million babies by the year 2030? For the world to save 16 million babies by the year 2030?
I think we need to work on 2 levels. First, policy commitment on national level, but then also policy commitment on district level by local chief executives. And then at the hospital level, we need 2 major interventions. One is to make sure that we provide quality of care at healthcare facilities. And once that quality of care is provided, then we also create automatically demand for services, which means that women will come to those services, because you have to see in some of the sub-Saharan contexts, women, they walk on foot being pregnant for days to reach to a hospital or to a healthcare facility. And that if that healthcare facility has not a good reputation, is not providing quality of care, the woman will think twice whether she will go and then deliver at home, maybe with a traditional birth attendant, which is not ideal. So I think it's creating the quality, but also creating the demand at the same time. And then what we emphasize in the report are really 4 pillars. It is people, places, power, and products. People being the healthcare providers themselves, places are hospitals, healthcare facilities being available. Power means that we want to empower women. We know that empowerment of women and their higher education leads to lower mortality rates in families or among children, and also to better health outcomes. And products. Products means, for instance, water in healthcare facilities, but also ultrasound machines or surgical facilities. I think what the difference is between sub-Saharan Africa and some of the countries we see in Asia is that a lot on the product side still has to be done.
Zek, are there any factors to take advantage of in trying to close this gap?
I think the social accountability, which means that communities should hold healthcare providers accountable for what they provide, is a very strong instrument that we have in hand and that we should use much more. And I think also with mobile technology nowadays, we can even get feedback about some of the healthcare facilities' performances, and we're doing that already. So, if somebody was unhappy or happy with the service, that can be an SMS or an application that can help to get this information, generate that information, and feed it back to healthcare facilities. In such a way, we can improve quality of care. And as you know, many people on the sub-Saharan Africa or an African continent, they have mobile phones nowadays. So UNICEF is very much counting on innovations, and mobile technology is one of them.